Good afternoon. Good afternoon, everybody, and welcome here in Copenhagen for this important Congress, the EULAR 2022 Congress, that is a hybrid event. Welcome to the EULAR family, because all together is better. And EULAR turns 75 years old these days, but looks much younger. And I am extremely proud for the achievement of EULAR over the past 75 years. And we are all here today in Copenhagen for celebrating the jubilee of our organization and for the EULAR Congress 2022. This is a foremost Congress experience in rheumatology. And now let us look into the journey of EULAR over the past 75 years. What an inspiring journey. This is the journey through our organization. And now I would like to share some thoughts on the past of EULAR with our past president. It is my honor to welcome to the stage Professor Ian McInnes, my friend and colleague, who is presenting the past now. Ian.
Thank you, Anna Maria, and a very warm welcome to sunny Copenhagen. What an inspiring journey, what an extraordinary video. I hope there are memories for all of you there, and it's an absolute joy for me to just reflect a little on EULAR's extraordinary contribution to this past that we are celebrating. Pathogenesis-driven therapeutics. Can you imagine new medicines with the power and potential that we could only have dreamt of but a few decades ago, advances in biomedical and life sciences that are applied to the rheumatic musculoskeletal diseases to extraordinary effect. And then translating these scientific advances into real medicines required EULAR working with our sister societies, ACR, and other leagues around the world to classify diseases and to find outcome measures that allowed decisions to be made. But of course, EULAR is focused mainly on people with RMDs, and in this regard, we're very proud of the recommendations and treatment strategies that have been pioneered to optimize care. And through the work of our standing committees, our task forces, EULAR has optimized the integration of new technology, I think best exemplified most recently in the advent of imaging technologies, transforming care. And finally, through our world-class Congress and our increasingly persuasive advocacy program, EULAR has spoken and speaks with passion and purpose to advance the cause of people with rheumatic and musculoskeletal diseases in the educational, political, and wider domain. So what will happen in the next 75 years? Well, I don't know. There are no certainties in this wonderful world of ours, but of this I'm absolutely sure. EULAR will continue to celebrate our community and strive on behalf of our patients without reservation or limitation. Thank you, Anne Maria.
Thank you so much, Ian. The past is what we know as a platform for our present, but also for our future. So let us continue thriving on this journey. And we have now the first part of the EULAR Awards. And in recognition of special achievement in the field of rheumatic diseases, we present our annual awards. The Meritorious Award goes to Professor Hans Bisma and to Professor Gerd Burmester. And now we have the Honorary Awards. The Honorary Awards go to Professor Frank Butterai, to Professor Bernard Combe, to Professor Ellen Gravellese, to Professor Angelo Ravelli. Thank you, Frank. Thank you, Bernard. Thank you so much, Helen. Angelo, thank you very much. We also have Professor Tommy Zinga and Professor Chuck Lowe, who are not attending, but also had the Honorary Awards. And now we have an HPR Lifetime Achievement that goes to Professor Cristina Opava. Cristina, it's my pleasure. Another important achievement is the Stene Prize first place that goes to Nora Sofia Dubilier. Congratulations. So congratulations to all award recipients. And now the FOREUM 2022 Platinum recognition go to UCB, and receiving the award is Emmanuel Keme. Congratulations. And to Pfizer, and receiving the award, Isabelle Legard. Congratulations. And we would like really to thank both companies for their invaluable support. EULAR has achieved important goals in its 75 years of life. And nowadays, our organization is energetic and vital, but dynamic and strong at the same time. With the recent restructuring of our governance, EULAR is now characterized by a modern approach to the finalization of its aims and the completion of its mission. With its new structure, EULAR works actively at the forefront of rheumatology and operates on the global stage with our partners in ACR, PANLAR, APLAR, and AFLAR. EULAR works to stimulate, promote, and support education, research, advocacy, and prevention and treatment of rheumatic and musculoskeletal diseases. And all the pillars of EULAR work all together in order to meet these aims and our goals. EULAR Education has become the leading provider of professional and patients' education and training in rheumatic and musculoskeletal diseases by developing tailored material and courses and deploying innovative learning approaches. We also facilitate the broad access to these educational offers and foster and contribute to the harmonization of educational standards in rheumatology across Europe. EULAR Research has established a European Center for Research in Rheumatic and Musculoskeletal Diseases to serve as the focal point for rheumatology research in Europe and for international high-quality research collaborations and interactions. The Research Center of EULAR is the youngest member of our family. It was founded in 2020, and it aims to facilitate and accelerate research in the field of rheumatic and musculoskeletal diseases. But we also have EULAR Advocacy that directly engages with the European Union and with national political institutions as a recognized partner and source of expertise in rheumatic and musculoskeletal diseases as we move to improve research funding, social policy legislations, and quality of care. We advocate for the specific needs of patients and communities with rheumatic and musculoskeletal diseases, and we promote a pro-RMD policy agenda to governmental decision makers. The EULAR Quality of Care develops recommendations and criteria for the classification, diagnosis, and management of rheumatic and musculoskeletal diseases, and delivering preeminent comprehensive frameworks. Through all these efforts, we improve and implement standards of care for people with rheumatic and musculoskeletal diseases. And we promote and optimize access to care and communication between people with those pathologies and the professionals who are involved in their treatment. The EULAR Congress is annually a preeminent congress in rheumatic and musculoskeletal diseases. As you know, it is a fantastic experience, keeping the highest scientific standards and worldwide reputation. But the EULAR Congress also brings forth the spirit of international cooperation in Europe and with our international partner organizations. It involves all members of the EULAR family in an unforgettable setting with a high-value program. But the EULAR Congress is not only a conference, it is also representing the most important networking event in rheumatology. And this is why it is so important to be here together again. We have all the members of the rheumatology community gathering from all over the world to meet their colleagues and friends and discuss new ideas and new plans. After 2 years in a row of virtuality, for the first time in the history of EULAR, this year the Congress is a hybrid event. It runs both live in Copenhagen and online, offering several parallel sessions going on throughout the World Congress period. And we really welcome you here in presence in Copenhagen, but also those delegates who participate in our activities from home or from their offices. And while we are celebrating our 75th anniversary today, in the present, but we need also to look at the future of our organization and consider how we can better fulfill our mission of advancing rheumatological care across Europe. It is therefore important to identify the challenges as well as the opportunities that rheumatology faces. Rheumatic and musculoskeletal diseases can be serious illnesses and have a high prevalence. However, in European countries, there are still disparities in patient access to rheumatology departments, which is sometimes difficult. To help solve this problem, we must position rheumatology as an important, interesting, and essential field of medicine that is seen at the same level as other major specialties. In short, we must increase access to care for rheumatic and disease patients, we must improve rheumatology visibility to policymakers, and we must expand its notoriety to the layperson public. And we must also make it attractive to medical students when choosing their specialization. How can we, as EULAR, work together to solve all these important issues? Let's look at a rheumatology workforce, the Danish example.
Rheumatic and musculoskeletal diseases are among the world's most prevalent, disabling and burdensome non-communicable diseases. It is affecting more than 120 million Europeans, including children and young adults. However, despite high cost for late treatment and comorbidities, many European countries lack a sizable rheumatology workforce and knowledge of RMDs.
Denmark is an excellent example of RMD patient care. The number of rheumatologists per 500,000 inhabitants is extraordinarily high due to an excellent medical education. Every medical faculty in the country hosts a rheumatology department, with 3 even hosting a chair of rheumatology. In addition, the Danish model focuses on the principle of togetherness. Diverse healthcare professionals collaborate with rheumatologists in a multidisciplinary team to support RMD patients and offer guidance on non-pharmacological treatment options, such as healthy lifestyle, rehabilitation, and self-management.
While the healthcare staff maintain their positions as experts, the patient's perspective is considered at every level. The multidisciplinary care facilitates a holistic approach to patient-centered care, where the patient is proactively involved in decision-making at every stage of the process, from symptom start to goal setting. Patients are thus quite active in Denmark, and so are the patients' associations advocating for their rights and needs.
A perfect example of this collaboration is the Dansk Gigthospital in Sønderborg, which is owned directly by the Danish patient organization. My team of rheumatologists works closely with professors for rheumatologic rehabilitation, Professor Jette Primdal and Professor Anne Bremander, nurses, occupational therapists, physiotherapists, psychologists, as well as the patient organization, thus creating 3 equal support pillars within one hospital.
Denmark also excels in another aspect of accessibilities, providing patients appointments with rheumatologists quickly. There is a maximum 4 weeks waiting period for a new patient's access to a specialist appointment, guaranteed by the Danish law. Early diagnosis and treatment is crucial in making the patient feel well cared for and safe. Of course, there are differences in waiting times between different regions in Denmark, but it is still possible to talk to a specialist even when not getting an appointment right away. The patient is thus not made to wait for months for a necessary appointment.
So, what learnings can we take from Denmark's example? Even at hospitals not directly owned by patient organizations, patient-centered multidisciplinary care is the standard model in Denmark. The principle of togetherness gives patients access to information about their treatment and access to quick specialist appointments. Enabling patients to be surrounded by a multidisciplinary team addressing RMDs from different professional views from the start is a valuable way of building trust, creating treatment compliance, and preventing comorbidities further down the line.
Hello everyone, my name is Marianne Wind and I'm a Danish member of the European Parliament for the S&D group. I'm sorry I could not be there with you today at the EULAR Congress. I would therefore like to send my warmest greetings and wish you to have a great Congress. I'm proud to say that my member state is a great example for best practice for the ratio of healthcare professionals treating rheumatic as well as musculoskeletal diseases to patients, as well as a number of university lectures in rheumatology. There is still a way to go to secure that more member states will prioritize this agenda. I know that we, in this building, in the European Parliament, are doing what we can to push this agenda forward. And I hope that your Congress today can inspire and be a boost for more member states to follow that example. Have a fantastic Congress.
The Danish system is an excellent example, but our task in Europe starts at the universities. Increasing the number of specialists in rheumatology should be a crucial aim for the future, and this process begins at the medical schools. We need an optimal university representation of rheumatology for this reason. And the more medical students will select rheumatology as their field of interest, the more specialists will be available in the future for patients accessing our department and for patients having access to care. And we must also engage with key decision makers in government to make it clear the crucial relevance of recognizing the importance of rheumatic and musculoskeletal diseases and of optimizing access to care, which lead to efficient management of rheumatic diseases and finally to improved access and permanence to work for patients with those pathologies. And undoubtedly, we must make rheumatology visible to the public so that they are aware of the risk of rheumatic and musculoskeletal diseases, which lead them to early consult a specialist when needed. To share with us further perspectives into the future of rheumatology, it is my honor to welcome to the stage the EULAR President-elect, Professor Daniel Haletaha.
Thank you, Anna Maria, for these kind words. And actually, I'm not here to predict the future. I'm probably here to rather reflect with you how we can build this future together. And we've heard before from Professor McInnes and also from Professor Iagnoko that we have made tremendous advances in science and advances that have been facilitated and supported by EULAR. And I think now it is time to really bring this knowledge to the good of all individuals with rheumatic and musculoskeletal disease in Europe, regardless of their social, financial, or geographical constraints. And telemedicine might just be one example how specialized healthcare may be bridged to everyone. Other examples are diagnostic support tools that are powered by artificial intelligence, but also by natural intelligence, nourished by the power of the community, the intellect and the expertise with each and every one of us. And data. The polyomic era has long begun, and we learned that to understand that the challenge is really not to generate data. Tomorrow's challenges are how to homogenize, platform, share, and make sense of the data we generate every minute, every day. And EULAR can therefore not only be the scientific data hub, the supporting infrastructure, but also provide the expertise and the network that is necessary to create value out of data for individuals with rheumatic and musculoskeletal disease. So with all that said, the EULAR's 5 pillars that you heard before, research, quality of care, advocacy, congress, education, in the future will be even more important than ever. The future of EULAR therefore rests on close partnerships, collaborations across all its constituencies, and it will need to be digital and human. And I believe that it is EULAR's duty to create a logical and permissive environment that is fully accessible to all. And let us continue this journey together, tackle the remaining challenges for those who we care for. And let's do this as the close community that we are, the EULAR family. Thank you very much.
Thank you very much, Daniel, our President-elect, for such an inspiring overview over the future of rheumatology. And thank you to our communities, the EULAR PARE community, the EULAR health professional community, the EMUNET community, and the pediatric rheumatology community. We all together, with the pillars of EULAR, the member societies of health professionals, the member societies of patients' organizations and scientific societies, we as a family work all together for the future of our organization and for our patients who are afflicted by those pathologies. And now, in the recognition of research that shapes the future, it is my privilege to welcome to the stage the EULAR 2022 Abstract Chair, Professor Marta Mosca, to tell us more about the selection process and the name of the winners of the Abstract Awards. Marta.
Thank you. So, thank you very much, Anna Maria, and it's a pleasure for me to be here today. So EULAR has received close to 4,000 abstract submissions into different categories, and these were reviewed by 270 experts. And to the reviewers goes my really thank for the huge work they have done. They have selected the best research that we will view and we will talk about during this Congress. But we have also selected the Abstract Award. So it's my pleasure now to introduce to you the winners of the different categories for the abstract. So for the category undergraduate, I would like to invite on the podium Abdullah Al-Mayali, Elizabeth Rasmussen, and Dil Jobanputra. Congratulations. So for the category of basic science, the award winners are Lucy Marie Carter, Achilleas Fludas, Antonio Francesco, Christopher Lessard, Masahiro Nakano, e Chenfu Shi. Congratulations.
Congratulations. Our congratulations.
Congratulations.
Congratulations. Congratulations.
So for the category Clinical Science, the winners are Stefano Alivernini, Fabrizio De Benedetti, Damien Caillé-Portillo, Dorothy Kribolder, Jens Christian Pedersen, and Sevtap Turce Ulas. Congratulations to the winners.
Congratulations. Congratulations to you. Congratulations.
Congratulations.
Our congratulations. Very well done. Congratulations.
So now we move to the HPR category, and it's my pleasure to invite on the podium Anthony Fellas, Bart Puls, and Christine Marie Latocha. Congratulations.
Is you? Congratulations. Well done. Congratulations.
For Pare, we have Petra Borsier.
Congratulations. Well done.
Congratulations. And for the category FOREUM, for Translational Science, Blatz Buria. For Translational Science, Erdal Sag. And for Clinical Science, Anne Kamps.
Congratulations for your work.
Congratulations.
Well done. Congratulations. Our congratulations.
So congratulations to all winners, and let's meet outside at the posters and with the presentations. Thank you very much.
Marco. We have now our video. So it is a fantastic experience, and it is for me a great pleasure to welcome on the stage the vice presidents of the three pillars of EULAR, the PARE community, the health professional community, and the National Society, representing the three vice presidents of these three pillars of EULAR. And what does the future hold for the three EULAR pillars? Elsa.
Well, thank you, Anna Maria. This has been, in fact, a long and successful journey so far, as we've seen in the beginning. We need to remember that almost 50 years ago, EULAR has officially incorporated the so-called social leagues. Then, following the EULAR support to an initiative to implement the 2001 European Manifesto for People with Arthritis Rheumatism, comprising 10 calls to action and addressing the policymakers, health professionals, and other key stakeholders to ensure people with RMDs can live a full and independent life, the Paris Manifesto and EULAR decided that together they would be stronger and merged in 2008. And since then, in these 14 years, Paris has been growing as a EULAR pillar, being nowadays represented and embedded all across the entire EULAR structure and activities. And this means that not only the voice of people with RMDs is heard all over EULAR, but that EULAR activities are also disseminated through patient empowerment, either in advocacy, education, or research areas. Therefore, even if we cannot be sure on what the future can hold for us, we can certainly be sure that Paris will be strengthening the collaboration across EULAR, and as a pillar of EULAR, we'll be stressing the impact of RMDs in relation to other non-communicable diseases, increasing the awareness on RMDs, on their impact, and on the several unmet needs. We'll be working towards patient-centered care and on the implementation of the recommendations aiming to improve standards of care, but also access to care. We'll be, of course, promoting health literacy and digital health literacy. But mostly, we will also be empowering patient organizations and engaging people with RMDs in all EULAR activities, from advocacy to education and research. Therefore, the future of the Paris community will certainly be based on further and stronger collaboration, building upon EULAR's meaningful engagement and meaningful engagement experience and expertise, and relying on a growing alliance and a powerful network. So this is our hopes for the future and the way we see the future within EULAR. Thank you.
Thank you, Elsa. Thank you. And now, Professor Theophil Vrieland, our health professional vice president.
Thank you, Honorary. Thank you. I think that the role of health professionals in rheumatology will become all the more important in the care for people living with RMDs in the future. And that is because the number of people with RMDs will increase, the problems they are facing will become more and more complex, and the same holds for healthcare systems, which challenges the accessibility of care, already mentioned, which needs health literacy and digital skills. Here, health professionals can play a crucial role, as they are the health professionals able to provide holistic care, addressing not only the medical part, but all aspects of people's lives, including, for example, their families and loved ones and work. And in order to ensure that the care they provide is of excellent quality, having the ability to use evidence-based practice is key. And EULAR is unique in the sense that it provides a platform where clinical expertise, scientific insights, and education can be exchanged, not only among health professionals, but also between health professionals and rheumatologists, patients and scientists. And this provides an optimal environment for growth and improving standards of care for people with RMDs. In addition to sharing clinical and scientific insights, health professionals develop new research projects, educational courses, networking, and other activities. We want to expand these activities in the future and engage more health professionals across countries. We aim to do this by strengthening our links with health professional member organizations and liaising with health professionals in countries where such organizations are developing. In the future, we want to actively address barriers health professionals are currently facing in joining EULAR activities. But today we are happy that so many are participating in the EULAR Congress, either on-site or virtually. And we hope that we can reach out and engage with far more health professionals in the future. Of course, with the ultimate aim of improving the quality of lives of people living with RMDs.
Thank you. Thank you, Ter, for your insights into EULAR communities, activities, and the view of the health professional. And now we have Professor Zoltán Csekanec from Hungary, who is the Vice President of the Scientific Societies, our members' organizations.
Thank you, Anna Maria. When EULAR changed its name from European League Against Rheumatism to European Alliance of Associations for Rheumatology, they clearly set the goal to bring together all these societies, whether they are from rheumatologists, health professionals, or patients. And they appointed a new vice president, myself, as a vice president for scientific societies. That means that before, I think there was some heterogeneity within Europe. There were countries who were very much engaged in activities in EULAR. There were other countries who were not so active. And so we decided to fight for a little bit more geographical homogeneity, try to engage a little bit those countries who haven't yet found a way how to work for EULAR, whether it's a Congress abstract, whether it's a Congress talk, whether it's a content committee, or whether it's a recommendation committee. So we try to reach out to all the societies and also to individual members with an increasing numbers, so that they feel that they are directly connected to EULAR, and EULAR is not just a governing body. And that is for peaceful times. But of course, there are also non-peaceful times, like recent years. And this is the other story, when we have to reach out to societies and individuals. During COVID, we experienced that in many, many countries, there was a shortage for some anti-rheumatic drugs, which were also used for the treatment of COVID. So the advocacy committee, EULAR, and the scientific societies had to work together how to manage to bring these drugs back to the rheumatic patients. And then, of course, came the conflict between two countries, when, of course, we also got some signals that there is a problem in those countries and also in other countries treating the patients with rheumatic and musculoskeletal diseases. So then EULAR had to act promptly and had to reach out for those people again. So in summary, if it's peace or if it's not peace, EULAR has to be always alert and has to be aware that we have several member societies. They have different backgrounds, they have different activities, and I think they all want to belong to this EULAR family and EULAR network, and we have to be actively looking at them, actively contacting them, every single member, to make sure that they can act properly, they can reach us in peace, and if there is no peace and there is some kind of trouble, we can help them as soon as possible. Thank you very much.
So thank you very much. Thank you, all of you. And so you heard from the EULAR communities and the EULAR family members what is EULAR now. We have completely restructured our governance, and we have made a new society, a new organization that is based on the past but is more dynamic, and an organization that is based on inclusivity, on sharing the same ideas and discussing and interacting, and in a very important networking. And the EULAR Congress is a very important networking platform. We know everybody who has attended previous live congresses has experienced that the EULAR Congress is a way for meeting colleagues, discuss new ideas, new plans. So we are very excited and very happy to welcome you all here, but also we are very welcoming also those who couldn't join us, and we hope in the future that they will come again here. And now, before I begin with my closing remarks, I would like to share a message of peace from our community.
Eminet. The emerging EULAR network. It has no boundaries. We always
work side by side
with friends
from every country
in Europe and beyond.
Peace.
Rauha. Rahu.
Läpi.
Taika.
Pace.
Pace.
Shridoba. Mir. Mir.
Mir.
Mir.
Peace.
So you have heard that above all, at our heart, is the EULAR family. The EULAR family is the new fantastic team of people working together across the three pillars of a medical, health professional, and patients organization, under the crucial principles of inclusion, equity, geographic distribution, and meritocracy. Welcome to the EULAR family, to you all. To all who are here in Copenhagen and those who are in the offices or they are at home, because all together is better. And now we have a video showing a big surprise for the celebrations of our organization, the 75th anniversary. You will see that in our EULAR village, there is a big surprise. You see a video on the screen already? There will be a fantastic surprise that is a big cake that is present at the EULAR village. So as soon as you go out after this opening ceremony, please move to the EULAR village, and there will be a celebration of the 75th remarkable anniversary of our organization that hosts us today. So you will see a big cake, and as soon as you go out from that side, you will see the EULAR village with this big cake celebrating our anniversary, 75 years of our organization that are shown here in this video. So thank you again. Welcome to the EULAR family, because all together is better, and enjoy our Congress in these 4 days. Thank you very much. Thank you to all.